Linagliptin, complete drug information. Now 1. Generic name, drug class, brand name, drug forms. Generic name, Linagliptin. Drug class, dipeptidylpeptidase 4, DPP4 inhibitor. Oral hypoglycemic agent. Brand names, Tradjenta, monotherapy tablet, Glixambi, Linagliptin plus empagliflozin, Gentadueto, Linagliptin plus metformin, Trijardi XR, Linagliptin plus empagliflozin plus metformin. Dosage forms, oral tablets, 5 milligrams, most common strength, combination tablets, varies depending on codrug. 2. Definition. Linagliptin is an oral antidiabetic medication used in type 2 diabetes mellitus, T2DM. It belongs to the DPP4 inhibitor class, which works by enhancing incretin hormones that regulate glucose. It is not an insulin substitute, but improves postprandial and fasting glucose without causing significant hypoglycemia. 3. Mechanism of action. Normal physiology. After a meal, incretin hormones GLP-1, GIP stimulate insulin secretion and suppress glucagon release. Problem in T2DM, incretins are rapidly broken down by the enzyme DPP4. Linagliptin effect inhibits DPP4 enzyme, increases incretin activity, increases insulin secretion, glucose dependent, decreases glucagon secretion, reduces hepatic glucose output, lowers both fasting plasma glucose and postprandial glucose. Result, better glycemic control, low hypoglycemia risk since action is glucose dependent. Number 4. Uses. Primary use, management of type 2 diabetes mellitus, T2DM, to improve glycemic control as monotherapy when diet exercise alone not enough, combination therapy with metformin, sulfonylureas, SGLT2 inhibitors, thiazolidinediones, or insulin 5. Indication FDA EMA approved, adjunct to diet and exercise in adults with T2DM. Not indicated for type 1 diabetes mellitus, T1DM, diabetic ketoacidosis, DKA. 6. Contraindications, absolute contraindications, hypersensitivity to linagliptin or any excipients, history of angioedema, urticaria, or anaphylaxis. Not recommended in type 1 diabetes, diabetic ketoacidosis. Measure 7. Before taking this medicine, precautions. Tell your doctor if you have history of pancreatitis. DPP4 inhibitors may increase risk. Heart failure, rare risk, but some DPP4 inhibitors associated. Severe hepatic impairment. Use caution, though no dose adjustment usually needed. Pregnancy, breastfeeding, not enough safety data, avoid unless necessary. Special populations, elderly, generally safe, but watch for hypoglycemia if combined with sulfonylurea insulin. Renal impairment, no adjustment needed. Advantage over sitagliptin, saxagliptin, elagliptin. 8. How to use. Take orally once daily, with or without food. Try to take it at the same time every day. Swallow whole with water. Do not crush or chew. 9. Dosing information. Adults. Standard dose, 5 milligrams orally once daily. Renal impairment, no adjustment needed. Unique among DPP4 inhibitors. Hepatic impairment, no adjustment usually required. Pediatric use not approved. Safety and efficacy not established. Number 10. Missed dose and overdose. Missed dose. Take as soon as remembered, unless it is almost time for the next dose. Do not double dose. Overdose, usually well tolerated, studies up to 600 milligrams single dose with no severe toxicity. Risk of hypoglycemia mainly if combined with other antidiabetic drugs. Treatment, supportive care, monitor glucose. No specific antidote. 11. Stop or avoid taking. Stop and seek medical help if severe allergic reaction, anaphylaxis, angioedema, rash, hives, severe abdominal pain, possible pancreatitis, severe joint pain, rare FDA warning. Blistering skin lesions, possible bullous pemphigoid. 12. Side effects. Common, mild, nasopharyngitis, cold-like symptoms, cough, sore throat, headache, arthralgia, joint pain. Less common, hypoglycemia, mainly when combined with insulin or sulfonylureas, increased uric acid levels, weight neutral, does not cause gain or loss usually. Serious, rare, pancreatitis, severe persistent abdominal pain radiating to back, hypersensitivity reactions, anaphylaxis, angioedema, urticaria, bullous pemphigoid, autoimmune blistering disorder of skin, severe arthralgia, may resolve on stopping. Number 13. Vital information. Does not usually cause weight gain, advantage over sulfonylureas insulin, very low risk of hypoglycemia when used alone. Unique advantage, no renal dose adjustment needed, safe in CKD. Monitoring required, blood glucose and HbA1c, signs, symptoms of pancreatitis or severe allergic reaction. Other drugs that affect linagliptin, P-glycoprotein CYP3A4 inducers reduce linagliptin levels, lowering effectiveness. Examples: rifampin, phenytoin, carbamazepine, St. John's wort. Other antidiabetic drugs may increase risk of hypoglycemia. Insulin, sulfonylureas, glipizide, glyburide, etc. Combination therapy with metformin, SGLT2 inhibitors, or TZDs, generally safe, but requires glucose monitoring. Snatch a summary, key points. Linagliptin equals DPP4 inhibitor, Tradjenta. Dose, 5 milligrams once daily, with or without food. Main use, type 2 diabetes, not for type 1 or DKA. Advantage, safe in renal impairment, weight neutral, low hypoglycemia risk. Watch out for pancreatitis, hypersensitivity, joint pain, skin reactions. Interactions, rifampin and other enzyme inducers reduce effectiveness. Insulin sulfonylurea increase hypoglycemia risk. Thank you. Have a nice day.